All right, well, hello, everybody. Thank you for joining us. I'm Joan Ingersoll. I'm the director of the Carlisle Council on Aging. I've met some of you and some of you I have yet to meet, but we're very excited today to have Clyde Kessel with us doing his presentation. Clyde has been our Shine counselor since 2013. And for those of you who aren't familiar with Shine, Shine provides people who have Medicare with access to free, accurate, unbiased health insurance information, as well as counseling and assistance. And they do this through a network of trained volunteer health benefit counselors. We're very lucky to have Clyde. He provides services to seniors in both Carlisle and Concord, but he's a longtime resident of Carlisle. And also on the side, as a volunteer, Clyde is the one who manages the COA's medical equipment loan program, which is a really fantastic program. We help a lot of people, and Clyde works tirelessly to match up the right person with the equipment that they're looking for. So we're really happy that you could all join us to learn more about what Clyde is going to present in terms of information related to Medicare. So without further ado, I'd like to turn it over to Clyde.
Thank you, Joan. And I'm going to try to get through this in an hour or so that I can go out and do a medical equipment delivery in town this afternoon. So we'll get started. I'm going to start off with a spoiler, and that is that I don't have the information about what your premiums are going to be next year. And we don't know what the hospital copays or the deductibles are. That information generally comes out in November. I don't expect that it will change enough from what it is in 2020 to affect anybody's decisions on any plans they're going to sign up for. There will be small increases, but probably not much. Another little thing, this is something that they started in the beginning of 2020, is the My Medicare account. It's something anybody who's comfortable on the internet, I strongly recommend you create a My Medicare account. And you can do it at either of these two websites here. They both are the same thing. They're a little different, but they take you to the same place eventually. It's a huge help for me when I'm trying to help you use the plan finder to compare prices. If you have a My Medicare account, it will make things go better. You don't have, if you're not comfortable with the internet and you don't want to do that, that's fine. We can manage as well, but it does make things work more smoothly. You can put your prescription drugs into the system, or I can put them into the system. And if you have a My Medicare account, it will remember them and they'll still be in the system the next time we try to do it. We do use the Medicare.gov plan finder. It's the go-to tool to compare different plans, to compare the prices of your prescription drugs primarily. For some strange reason, it never works very well during the last 2 weeks of October. It's partly a combination of them trying to jam in a whole bunch of last minute changes into the system and the sudden load of people going on for open enrollment. It has not been working very well the last 2 weeks, but I believe it's just about there now. And I'm going to be ready to start using. It illustrates your two choices when you sign up for Medicare. Is on the left-hand side is original Medicare, where you enroll in Part A and Part B, and you also enroll in a standalone drug plan. It provides your prescription drug coverage, and most people enroll in a Medicare supplement. It's also known as a Medigap plan that covers the co-insurance from Part B. And some of them also cover the deductibles for Part A and Part B. So this is your a la carte system called Original Medicare. And the other choice is Medicare Advantage, the other side of the screen here, where you enroll in a plan that rolls all of your coverage together into a single unit. It's typically it's going to be an HMO or a PPO, so you have a doctor's network you have to worry about. The Medicare Advantage plans, the advantage is very low premiums, typically zero premium. It includes your doctors, hospital, and drug coverage all rolled into one, and you pay for it as you go through copays. If you're healthy and you don't go to the doctor much, it's a great solution where you have very low premiums, and if you don't go to the doctor, then you don't have any copays. People who are not happy being in an HMO, they want to have more freedom on which doctors to choose, or they use a lot of doctor services and are afraid that the copays are going to be too high, then they typically stay with original Medicare, which has higher premiums, but much lower copays. Those are kind of the two choices that everybody's faced with when they enroll in Medicare, and during open enrollment every year, they can reevaluate and make changes. So open enrollment is from October 15th to December 7th every year. And during that time, you can change any of those plans that you've chosen. As an aside, or an important fact, the Medigap plans, that's the blue box down here on the lower left, the Medicare supplements. In Massachusetts, those plans have continuous open enrollment. You can, if you have a Medigap plan, you can switch anytime you want during the year. Any change you make will be effective on the first of the following month. In addition to the standard open enrollment period that we're in right now, in 2020, they started a new thing called the Medicare Advantage open enrollment. That lasts from January 1st to March 31st. And it lets you do anything that you could have done during the standard open enrollment period. The only restriction is that you have to be in a Medicare Advantage plan on January 1st. That anybody who's on a Medicare Advantage plan on January 1st has an extra 3 months to make any change whatsoever. So if you're a procrastinator, you're getting to the end of open enrollment, it's December 7th and you can't decide what you want to do, well, just pick a Medicare Advantage plan at random and enroll in it, and then you'll have 3 more months to make up your mind. You can use this, you can only make a change once during the January 1st to March 31st period. You can make one change, and once you've done it, then that's it for the rest of the year. There's another slight variation on that plan, which is if you turn 65 and enroll in a Medicare Advantage plan at the same time that you enroll in Medicare, then you have 3 months to change your mind. You can switch to a different Medicare Advantage plan, or you can switch back to original Medicare. The idea being, here you are, you're brand new to Medicare, you've picked a Medicare Advantage plan, and then a couple of weeks in, you discover that your doctors aren't in the network, or you don't like the way it works, and they give you a chance to change your mind and get back out. There are about 30 other special enrollment periods. They call them special enrollment periods, but what it really is just a rule that says under certain circumstances, you can change your plan. And there's always some kind of a restriction about what kind of change you can make or when you can do it. One of the ones is called the 5-star rule. That Medicare Advantage plans, that's the orange box, and the drug plans, the yellow box, they are given a star rating from Medicare based on user feedback, how well they follow the rules, and so forth. And the 5-star rule says you're allowed anytime you want to switch into any 5-star plan. In the past, there were a couple of drug plans that were 5 stars. The 2 Blue Cross drug plans had 5 stars. And all of the Tufts Medicare Advantage plans had 5 stars last year. And this rule let you switch from one side to the other. You could switch from a Medicare Advantage plan to original Medicare, or you could switch from original Medicare into Tufts Medicare Advantage using the 5-star rule. Unfortunately, the Blue Cross drug plans lost a half of a star for 2021. So they no longer have 5 stars. The only remaining 5-star plan is the Tufts Medicare Advantage. I think there's 5 of them, 5 or 6 of them, and they're all HMOs. The 5-star rule says you can switch from whatever plan you have into any one of those Tufts plans. You only get to do it once during the year, but you can do it anytime you want. An example of when you might want to do that is if you're on there's a Tufts plan that has 0 premium, but it has fairly high copays. And in particular, if you had to do a cancer treatment, the copay on that plan is 20% of the chemotherapy charge, which is huge. That's a huge amount of money. And you could use the 5-star rule to switch into a better Tufts plan, which has a 0 copay for the chemotherapy. And you'd save yourself about $3,000 by doing that. So that's one of the special enrollment periods. There are some others. The very first time you join a Medicare Advantage plan, you have 12 months to try it out. And if you don't like it, you can switch back to original Medicare. This particular special enrollment period doesn't let you switch to a different Medicare Advantage plan. It only lets you switch back to original Medicare. Prescription Advantage is a Massachusetts program. I'll talk about a little bit more later on. If you enroll in Prescription Advantage, it's free. And one of the things it gives you is 1 extra chance to change plans in the middle of the year. So you can make any change whatever you want if you're a member of Prescription Advantage, but you only get to do that once a year. If you're on the low income subsidy or you're on Medicaid, that's Mass Health, then you get 3 extra chances to change plans anytime not anytime, actually they're once per quarter. The first quarter, second quarter, and third quarter of the year, you can change plans. They used to allow once every month, but people were using that to abuse opioids. So they dialed that back to make it harder for people to switch drug plans and get too many opioids. I'm wanting to have any questions come up on the chat? No? Okay, well then I'll just keep going. Some issues about Medicare Advantage plans for 2021. Now we're talking about the orange box here on my favorite picture. When you're choosing one, I think we sent out by email, we sent out a package of the data sheets to everybody who's here today, I believe. And in that package, there's an orange sheet, which is a very condensed, concise list of various copays associated with each of the Medicare Advantage plans. And that gives you a kind of a start. You can use that sheet to compare and look and see what your copays are for next year on your current plan and decide whether you want to switch to a different plan. The orange sheet that we sent out does have information for 2021. It's been updated and has all the new data. A couple of columns on there that are important. There's a column on there labeled OOP maximum. That's your maximum out-of-pocket cost. So all of your co-pays for medical services, that's hospital, doctor, chemotherapy, all of those co-pays are capped at your maximum out-of-pocket. And it typically ranges from $3,000 to $10,000, depending on which plan you sign up for. Another column that's important is the Part B meds. That's the Part B medications. Those are drugs that are administered in a doctor's office. And the big one there is chemotherapy. And most of the plans charge you a 20% copay for Part B medications. And that can be a lot of money, and it can very quickly run you right up to your maximum out of pocket. And once you reach your maximum out of pocket, then there won't be any more copays for doctor service, hospital service, or the Part B. The Part D drugs, those are the drugs that you pick up at the drugstore. They are covered by your Medicare Advantage plan, but they are not included in your out-of-pocket maximum. The Part D drug plans are always separate from the out-of-pocket maximum. They have their own out-of-pocket maximum, which is around $6,000. I guess I'll mention that a little bit more later. What else here have I got? This thing about extra benefits, they're called supplemental benefits, which I find confusing because the blue box is the supplemental plans. But Medicare Advantage plans are allowed to provide supplemental benefits in addition to the standard stuff. And they are competing with each other, and every year they seem to offer better supplemental benefits. And you should be thinking vision, hearing, and dental. That some of the Medicare Advantage plans are offering really credible dental coverage. It's dental coverage that's good enough to be worth signing up for that plan to get. So if you are interested in Medicare Advantage plans, this might help you decide which one to sign up for. What I kind of suggest on how to pick a Medicare Advantage plan is if you look on the orange sheet, there's 6 companies. First thing you want to do is check with your doctors and find out which Medicare Advantage plans they accept. And that's going to narrow down your choice down to 2 or 3 probably. And then you can look at the plans in more detail and find out whether you're going to be able to take advantage of their dental and vision and hearing benefits, and whether or not the co-pays that they offer are reasonable to you. This item right here, just mechanically, if you decide to make a change during open enrollment, the Part D drug plans and the orange Medicare Advantage plans, they're all mutually exclusive. You can only be in one of those at a time. And the federal computer systems guarantee that. So anytime you enroll in a drug plan, this yellow box, it will automatically disenroll you from any other drug plan and from any Medicare Advantage plan that you might have been in. You don't have to worry about that. Same thing, if you enroll in a Medicare Advantage plan, it will automatically disenroll you from any drug plan or any other Medicare Advantage plan that you already had. That's all taken care of. The only thing you need to worry about is these Medigap plans down here that are not controlled by this. They're controlled, it's Massachusetts that administers them. And you always have to, if you're leaving a Medigap plan, you have to call them up on the phone and cancel your enrollment yourself. Nobody else is going to do that for you. So if you switch from original Medicare to Medicare Advantage and you enroll in a Medicare Advantage plan, that'll automatically kick you out of your old drug plan, but it won't automatically kick you out of your Medigap plan. You're going to have to do that yourself. Pre-existing conditions. It used to be that if you had end-stage renal disease, that means kidney failure, then you would not be able to enroll in a Medicare Advantage plan. That was the one pre-existing condition in Medicare that you had to worry about. That's gone. Starting in January, there are no medical conditions that can prevent you from enrolling in a Medicare Advantage plan. Some of you may have noticed that your doctors are starting to meet with you over Zoom. This is telehealth. It used to be very, very restricted under Medicare, but now with COVID, suddenly Medicare thinks it's a great idea, and doctors have a lot of freedom to meet with you over Zoom. It keeps everybody safer. I don't know if we have any veterans listening right now.
Yes, we do. We do. You want me to let you know what they are?
No, but there's a new plan, a new Medicare Advantage plan from Aetna, which is designed for veterans. It does not have any drug coverage built into it. This would be for somebody who gets their drug coverage through the VA for free. And then you'd be looking for a Medicare Advantage plan that doesn't have the drug coverage built in. So that's new. The Humana one is not available in Middlesex County, so that doesn't matter to us. If there's anybody here whose primary care physician is at Harvard Vanguard, a couple of years ago, they only accepted the Tufts Medicare Advantage, and then they added Blue Cross Blue Shield. And now this year they're adding Harvard Pilgrim Healthcare as well. So people at Harvard Vanguard have 3 choices of Medicare Advantage plans. And I already mentioned that the dental, vision, and hearing is starting to get worth looking into. There's a new kind of a plan. This is brand new this year. It's classified as a Medicare Advantage plan, and it's in this presentation as a Medicare Advantage plan, but I think it really is more like a Medigap plan than Medicare Advantage. It's a high deductible plan. You enroll in this insurance plan and you have a deductible of $5,000. So you're responsible to pay for your first $5,000 of healthcare. They give you a bank account with $2,000 in it that you can use for any medical expense you want. And at the end of the year, if you haven't used it, it rolls over into next year. It's your money forever. It's only available for medical expenses. So this, if you're healthy and you don't go to the doctor much, this might work out. You have to be emotionally prepared that if you go to the doctor, it's going to cost you $100 or more for a doctor's visit, because you're paying the doctor, you're paying the Medicare, you have to pay the Medicare approved amount, which is typically going to be $100 for a doctor's visit. You also have to be financially prepared to pay up to the deductible amount of $5,000. So if you're healthy and you can take the risk of a $5,000 expense, then this actually might turn out to be a nice way of getting your insurance. You do get to see any doctor any Medicare, you can go to any Medicare doctor. There's no network that you have to worry about. You do have to get a separate drug plan because this plan does not include drug coverage. So you will have to get a standalone, any one of the standard standalone prescription drug plans, and you use the plan finder to choose that. There are 2 plans available in Massachusetts this year. They're both from Lasso, and one of them has a $5,000 deductible, and they give you $2,000 in your medical savings account. The other one is an $8,000 deductible, and they give you $3,000. You can go to their, if you're interested in this, you can go to their website and find out more. That money that they give you, you can use it on anything that you would have been able to deduct off your income taxes. It's a IRS form 502, lists all the things that you can use as medical expenses. You cannot use it to pay your Part B premium, unfortunately. This is something, if you're enrolled in a Medicare Advantage plan, you should be aware of this. The step therapy is something where the insurance company says they know better than your doctor which drugs you should be using. And the Medicare Advantage plan can force you to try a cheaper drug, and only if that doesn't work will they let you use the more expensive drug. This has existed for quite some time on drug plans, but now they're starting to use it for the Part B drugs. That's, think chemotherapy. So can you imagine if you have cancer and you're starting a course of chemotherapy and the insurance company is deciding that they want you to use a cheaper drug rather than the more expensive one? It's kind of scary. It's something you should be aware of. I wonder, did any questions come up on Medicare Advantage?
Yes, I have 3 questions that came in. The first was just a point of clarification. The sheets that we sent out, some of them say that you have 2021 rates and some of them say 2020. So you said that things are going to be updated for next year, but some of the sheets are already updated. Is that right?
Yeah, the orange sheet for Medicare Advantage is updated for 2021. That's the orange sheet that you have is correct. The yellow sheet, which is the drug plans, is also correct for 2021. The one that's out of date is the blue one for the Medigap plans, because we just don't have the numbers yet.
Right, okay.
And like I said, I don't think the numbers are going to change enough that it really matters.
Okay, so that was one question. And I have, somebody wrote, I changed from Blue Cross Blue Shield MedX to Blue Cross Blue Shield PPO last year, and Blue Cross continued to take premium payments from my bank account until I caught it in October.
Wow, okay, because I assume on this person, they moved to a plan with a cheaper premium. I guess that shows why you should pay attention to your bank account every month.
Have you heard that before, though?
I have not. I have heard that Social Security will do that. That if you have your premiums deducted from your Social Security check, you can do that for drug plans or Medicare Advantage plans. You can have them deducted automatically from your Social Security. And when you switch plans, I think it's typical for there to be a couple of a month delay before Social Security catches up. But they do they do get things straightened out, and you end up paying the right amount of money. It just takes a couple of months for them to catch up.
All right, a couple more questions. What are the pros and cons of original versus Medicare Advantage?
Well, original Medicare, there's no doctor's network and no referrals. You can go to any Medicare doctor you want to, anytime you want to. There are no copays. there is a deductible, but there are no copays. The premiums are relatively high. You're basically paying in advance for a lot of doctor services, whether you use them or not. The Medicare Advantage is kind of the opposite. You have to work within their network. Even the PPO plans still have a network that you have to worry about. If you're in an HMO plan, you have to get a referral before you can see a specialist. The premiums are very low, typically zero. But so you're not paying up front, you're paying as you go. You have copays. Every single time you even think about your doctor, you're going to have a copay. So if you're healthy and you don't go to the doctor much, it's great. You're not paying in advance for services that you're not using. But you do have to be willing to live inside the HMO network model.
Okay. Can you discuss other plans such as G and N?
No, I can't, because we live in Massachusetts and those plans don't exist in Massachusetts. This is, so somebody's jumping ahead to Medigap, and I'll talk about Medigap a little bit later on.
Okay, one more question. If I am already enrolled in a Medicare Advantage plan and want to continue with the same plan, do I have to do anything, or will I automatically be re-enrolled?
If you don't do anything, you will automatically be re-enrolled in the same Medicare Advantage plan for next year. The same is pretty much true of drug plans, although there are always a couple of drug plans that pull a fast one on us and they change your enrollment into a more expensive plan unless you do something to stop it. And I'll talk about those momentarily. But the Medicare Advantage plans, yeah, they all just sort of roll over. Some years there are plans that get deleted and then they'll send you a letter telling you what plan they will roll you over into. But this year there aren't any like that.
Okay, those are all the questions that have come in so far.
Okay, thank you.
Yep.
Now I'm going to talk about the drug plans. That's people who are on original Medicare and need to pick a drug plan. And there's lots of stuff to talk about. And as I mentioned earlier, Medicare.gov has a wonderful tool called the Plan Finder, which any day now will be working properly. And it's the tool that I use, and it's the tool you can use either by yourself or with me, or you can ask me to do it for you. Any one of those choices is fine. I'm glad to help in any way you need. Drug plans, they all have this common structure. It's a Medicare Part D drug plan. It has to follow a bunch of rules set by Medicare. And they have a deductible. The maximum deductible for next year is $445. Some of the plans have that's their deductible. Some of the plans have a lower deductible. Some of them have a $0 deductible. Typically the ones with a low deductible have a high premium. The ones with a high deductible have a low premium. After you satisfied your deductible, you're in this region called initial coverage, where you get more or less good drug coverage. Depends on the prescription drug. It depends on the plan. On average, it tends to be your cost is going to be around a quarter of the retail cost of the drug. Some drugs are higher than that, some drugs are lower, but the plans are supposed to in some way average out to around 25%. Once you've reached a total, once you've used up $4,000 worth of drugs, that's at the retail price, then you get into what's called the coverage gap or the donut hole, where the pricing rules change. Once you get to the coverage gap, all of your drugs, you'll be paying exactly 25% of the retail cost when you're in the coverage gap. Until your out-of-pocket costs reach $6,500, And then the federal government comes in and kicks in and they pay 95% and you pay 5% after that. So so let's take an example. There's an example that has come up a few times lately, the drug Eliquis. It's a blood thinner that the doctors just love it. It works really well, but its retail cost is $500 a month. The drug plans typically charge you about $40 or $50 for a month. And after 8 months times $500, your retail cost has come up to $4,000. That's the end of your initial coverage, and you've fallen into the coverage gap or the donut hole. And after that, you're going to be paying 25% of the cost of the Eliquis. 25% of 500 is about $125 is what you're going to be paying per month until you get up to $6,500, which most people don't get that high. So that's kind of how the donut hole works. Like it starts at 40 when the numbers are stupid. It starts at when the retail cost gets up to 4,000 and it ends when your out-of-pocket costs get up to 6,000. I mentioned Eliquis. It gets more expensive when you get to the donut hole. Some drugs, another example I came up with is albuterol. What was it? I think it was around, during the initial coverage period, it typically is around $40 or $50 a month. And when you get to the donut hole, it drops down to about $10 or $20. It's just that some drugs get cheaper, some get more expensive. If you are getting into the donut hole, then you should, if you can, you should join Prescription Advantage. It's a free program, Massachusetts state. It's easy to enroll. Your income limit is, for a single person, is $3,100 a month. If you're married, is $4,300 a month. So, a lot of people aren't eligible, but if you are eligible for this, then by all means, you should enroll in it. And one of the benefits it does is it makes your drugs cheap when you get to the donut hole. Once you get to the point where your Eliquis was going to start costing $125, all of a sudden it'll get a lot cheaper. The actual price you pay for it depends on what your income is. So that it's a great plan to join. You can do it online. I can help you do it, or I can point you to, get in touch with me and I can tell you how to enroll in it. There's a new program this year to help with insulin cost. They call it the Part D Senior Savings, but insulin is expensive and the government is trying to make it more affordable. And there is a plan in place that flattens out. It makes the insulin cost $35 a month, regardless of the donut hole, regardless of your deductible. If you fit into this plan and you use insulin, it'll cost you $35 a month. Not all of the drug plans offer this, and not every type of insulin works with this. So if you are using insulin, I suggest you get in touch with me through the COA, and we can work together to find out whether you will be able to take advantage of this plan. The goal being to get into the plan where your insulin is $35 a month all year long. There are 27, there's 2 more drug plans this year than there were last year. There's 4, they have a pretty high premium and no deductible. More than half of the plans have this rule where the tier 1 and tier 2 drugs are not subject to the deductible. So it's always the cheap drugs that you go to the drugstore in January and they don't affect your deductible. You get them cheap right from day one. Let's see, what are some of the changes? Envision. There was an Envision plan for $14. It's changed its name to Elixir, which I think that's a better name for a drug plan. And there are two different Elixir plans, and they are automatically anybody who was in the $14 Envision plan is going to be automatically rolled over into the $34 Elixir plan. And if you are an Envision member, you got a letter in the mail a couple of weeks ago warning you about this and telling you what you need to do to stay in the cheaper plan. My recommendation is let's just use the drug finder and compare, with your list of drugs and figure out what's the best plan for you to be in, whether it's Elixir or not. But just if you were in Envision and you do nothing, your premium is going to more than double. Another plan that's pulling a fast one on us is Mutual of Omaha. They had a $24 plan and I think it was a $49 plan. And they are switching all of those people into their new $87 plan. And if you don't want that, then you need to take action. Once again, let's just use the plan finder and find a new drug plan for you. An $87 plan is probably not appropriate for most people. SilverScript is now run by Aetna CVS, and CVS and Walgreens are always fighting each other over drug prices. It seems that if CVS makes a deal with a drug manufacturer to offer something at a low price, then they require that Walgreens not get a low price. So lots of times you'll find with drug plans that they're cheap at CVS and expensive at Walgreens, or they're expensive at CVS and cheap at Walgreens. In any case, CVS is now controlled by Aetna. SilverScript is now under Aetna CVS. So if you're on SilverScript, you should expect that you're going to be going to CVS rather than Walgreens next year. They have a new plan that is only $7 a month. If you don't use prescription drugs, then this may be your go-to plan, because the premium is half of what any other plan premium is. This is brand new this year. And if you do have that plan and you do get prescription drugs, you're going to be going to CVS. There are 9 plans. This senior savings plan, that's the insulin thing I talked about. There are 9 plans that offer that. Raytheon, if we have any Raytheon retirees in the audience, they have dropped all drug coverage from their retirement plan. You're going to want to make sure you evaluate use the plan finder to pick a new drug plan for next year, for 2021. When you use the drug finder, they now allow you to pick 5 different drugstores and compare pricing. And you will very often find that the price varies from one drugstore to another. Sometimes the price difference is small, sometimes it's huge. What I generally do is I always, for my 5 drug plans, 5 pharmacies, I pick CVS and Walgreens. And one of the local grocery stores like Hannaford or Stop and Shop, because sometimes they have good pricing. And West Concord Pharmacy. West Concord Pharmacy is popular. A lot of people like to use it. It's a great pharmacy. And sometimes they have the rock bottom price. Not always. Depends on the drug plan. And then for the 5th choice, you can pick mail order if you like to. Extra help. This is for low-income people. It's called low-income subsidy. If you are on LIS, then every year you need to make sure that the drug plan you're in is one of the plans with a $0 premium. When you're on LIS, the low income subsidy, they pay a portion of your drug plan premium for you. But they won't necessarily pay the whole premium unless you're on one of these plans for next year's. Are there any questions on so far on?
Yep, we had 2 questions. One, why do insurance companies ask for your date of birth before they will give you any information?
Well, part of it is the answer to your question may depend on your date of birth. And that's actually on the next slide. That may be part of it, but I think, they want to capture information for marketing, and they want your name and address and everything so they can send you mail and call you on the phone and all of that. And I think there's no way around that. And I don't know if knowing your date of birth is part of matching up your records so they don't get duplicates. I don't know the answer to that question. On to Medigap. That's this last box down here we haven't talked about. These are the plans. They're controlled by Massachusetts. Well, here, this is what they do. In other states, it's an alphabet soup. There are Medigap plans called A, B, C, D, E, F, G, H, I, and J. And they all have different levels of what deductibles and what copays they cover. Massachusetts and Minnesota have a very simplified version. They don't use the letters. What we have is we have 3 plans. One is called Core. That's this one here. One is called Supplement 1A. This one was brand new last year. And the last one is Supplement 1. Now, more than half of the people who buy Medigap plans buy them from Blue Cross Blue Shield because they happen to be the one with the lowest premium. And Blue Cross Blue Shield, just for reference, they have brand names. The Supplement 1A, Blue Cross Blue Shield calls this one Sapphire. And it calls Supplement 1, Blue Cross Blue Shield calls this one Bronze. So when you hear somebody talking about, oh, I have bronze, they're talking about this Medigap Supplement 1. If you don't have a Medigap plan and you go to the hospital, boom, you owe the hospital $1,408. That's your deductible. And any doctor's bills that come in, you owe the first $198 and 20% of, that's actually, it's not really, strictly speaking, that's a co-insurance, not a copay, but that's what you would owe if you didn't have a Medigap plan. Now, the cheapest Medigap plan you can get is called Core. It costs you a little bit over $100 a year. And you're still liable for the $1,408 to the hospital, and you still owe the first $198 to your doctors, but there's no more of that 20% copay. And the 20% copay, oftentimes it's not much. You know, if you go see a doctor, the Medicare allowed amount is only about $100, and 20% of that is $20 would be your copay for a doctor's visit. So normally that's not much, but if you are getting chemotherapy, that's under Part B. Without this Medigap plan, you would owe 20% of your chemotherapy and you'd go bankrupt pretty quick because there's no maximum out of pocket. I want to go back one slide. We're talking now about being on original Medicare, which is totally different from the Medicare. I talked earlier I talked about the copays for Medicare Advantage and how there was a maximum out of pocket and various different copays. The structure of copays and deductibles when you're on original Medicare is different, and that's what we're describing right here. So when you're on Core, if you do get a core plan for $100, all that plan does for you, all it does is it pays that 20% copay. If you get supplement 1A, then it's going to cost you around a little bit over $175. And what it does is it pays, not only does it cover the 20%, but it also pays your hospital deductible of $1,408. So you're paying quite a bit more in the premium, and you're reducing your risk of having that $1,400 hit. The bronze, the supplement 1, is the Cadillac plan. It costs you more than $200, and it pays all of your hospital and doctor's bills. As long as it's something that's covered by Medicare, then you don't have to pay a penny. It is expensive. A lot of people like it. It's a very popular plan. As I mentioned earlier, you can switch around these plans anytime you want during the year. The change will take effect the first of the following month. So if you're in the ambulance on the way to the hospital, it's too late to switch up. But if you're going to have a scheduled surgery, you're getting your knee replaced next month, you can switch up from core into Sapphire and you can save yourself $1,400. These numbers will be slightly higher next year. I'll probably, in a couple of weeks, we'll all know. Supplement 1 is, they're trying to phase it out. If you were born after January 2nd, 1955, you are not eligible to buy supplement 1. You have to get supplement 1A. The difference is not great. It's the only difference between them is this doctor's deductible here. Somehow Medicare decided they want you to have a little bit of skin in the game. They want everybody to have to pay the first $198 of their doctor's bills. Medic's Choice is an old plan that was phased out a couple of years ago. Thank goodness. Okay, Blue Cross Blue Shield has always been the lowest premium plan. It looks like maybe Health New England is edging them out, but only for supplement 1A for next year. I don't know what the exact numbers are though. And none of the, we don't have any of the other numbers. So for all we know, some other plan is going to come in cheaper. I don't know. COVID testing is 100% covered. There's no co-insurance for COVID testing. Hospitalization is covered with all of the normal deductibles and co-insurance. Whatever you pay for any other hospitalization is going to be the same for COVID. With one exception, Medicare Advantage plans are allowed to waive the copay for testing. So your Medicare Advantage plan might give you the test for free. But don't expect them to give you the hospitalization for free. Telehealth, I mentioned, is a vaccine. If and when we do get a vaccine, they've promised that it will be covered 100%, which unfortunately is not true of Shingrix. If there's anybody here who has not yet gotten their Shingrix vaccine, my question is why not? It's a two-part vaccine. It's covered through the Part D drug plan or through your Medicare Advantage plan. There are 4 Medicare Advantage plans that give it to you for free, where free means less than $5. You know, there might be a small, the pharmacy might have a small dispensing fee, but basically you're getting the vaccine for free. All of the other Medicare Advantage plans and all of the drug plans, they charge you approximately this, $160 if you're in your deductible. And if you've already satisfied your deductible, then it'll be around $40 or $50. And that's per injection. So you have to pay that twice. And you go to a pharmacy to do that. There is some program, I think that number is wrong. I think the income limit is 2,600. If your income is below 2,600 and you've spent $600 on drugs so far, then you can get it for free from the manufacturer. This says your primary care physician must do the application. That's not quite right. I think it's the pharmacy does the application, but I don't know if that would fit anybody, if anybody who's watching would be able to qualify for that. We're getting to the end here. This is a program, it's a Mass Health Medicaid program where the key information here is it will pay your Part B premium. If you qualify for this program, the limits are relatively low, but there are plenty of people in Carlisle who would qualify for this. These limits were raised about a year ago. They're quite a bit higher than they used to be historically. And it pays your Part B, premium, and it gets you on that low income subsidy automatically for prescription drugs. That's a great deal. It pays your prescription drug premium, and you get no prescription drug ever costs you more than $9. So if you or anybody you know is eligible for this, you should get in touch with me. The application is real simple. It's only 2 pages. Here's a website you can go to if you want help, if you need in-home assistance or something. This is just a resource website. We're only a couple of minutes over. Are there any questions that came in?
Yes. Do the Part B step therapy shenanigans apply to Advantage plans or only to original Medicare?
Medicare Advantage plans only. I do not think that applies to original Medicare. There's nobody between you and your doctor. As long as it's considered medically necessary, then it's covered by Medicare.
Okay.
If you're on original Medicare, what I just said is not true about prescription drugs through your Part D plan. Your Part D plan, they can have prior permission and step therapy for Part D as in dog drugs.
Another question I think you answered right after it was asked. So if somebody turns 65 in 2021, they cannot buy supplement 1, is that right?
Correct. Unless they were to say, if they were eligible for Medicare through a disability prior to turning 65 and prior to 2020, then they would be eligible for Medicare Supplement 1 for the rest of their life.
Okay. Somebody wants to know, are you going to be sharing your presentation slides with the participants today?
I would like to do that.
That'd be great. We can help you do that if you want to.
Yeah, absolutely.
Yes. Okay. One person said very informative presentation that helped a lot, doesn't have a question. Somebody is asking, how do I find out whether doctors in Florida would be covered by Blue Cross Blue Shield PPO?
That's a very good question. I do know that United Healthcare has a system that lets you, they call it the passport option, that lets you say you're going to go down to Florida for a period of time, and they sort of move your network down there for you. And then when you come home, you call them up again and tell them I'm back home, and they move your network back up here. I don't know how that works for Blue Cross. I think that would be a question to ask Blue Cross.
Okay. One thing I just want to say about the slides, if you didn't register for the presentation, or if your what you name is on Zoom is not going to allow me to identify who you are, please send me a chat with your name so that we can forward the right people the slides from today. One person is asking, what do you think about GoodRx?
I meant to mention GoodRx. I'm sorry. Thank you for bringing it up. GoodRx is this wonderful tool. And actually, there are a number of different ones that are just like it. If you Google, drug discount, you should be able to find a whole fleet of them. I happen to use GoodRx myself. You can get an app for your phone, or you can do it on the website, goodrx.com. And you look up a drug, you put down what your dosage is and how many pills you want. And it shows you the kind of pricing that you should expect to get. And it gives you a discount card that you can use. And surprisingly often, the price you can get with GoodRx is better than the price you can get through your drug insurance plan. And so whenever I get a prescription from my doctor, I always check GoodRx first. At least that way I know when I get to the drugstore whether the price I'm getting is reasonable or not. There are situations where using your drug plan, believe it or not, your copay will be higher than the retail cost of the drug. This is one of the things about Medicare drug plans that you have to defend yourself against one way or another. And they have all of these tricks that they do, and sometimes they actually have a copay higher than the retail cost. And GoodRx or another website like it is your defense against that kind of shenanigans.
I think those were all the questions we got.
Okay.
Okay, well, I really want to thank you for your amazing presentation. That was really informative, and I know I learned a lot, so thank you very much for that. I also want to thank Chuck Bagnashi, who has provided the technical support for this meeting, as he does for very many meetings, so thank you very much. I did want to mention, I think there's 2 people from the COA staff also on the call. I think Miriam is Miriam Florimond, and Carol Grunike, who is our relatively new social worker. So if you haven't met Carol, there she is. Hi, Carol. And if anybody is interested in making an individual appointment with Clyde, a Shine appointment, you can call us at the COA and we will facilitate that for you. And our phone number is 978-371-2895. So I think unless anyone has any other questions, I think we're all set for today. Okay. Bye, everyone.
Thank you so much, Clyde.
Bye. You're welcome. Thank you.